Can we stand up and give the 42nd President of the United States a rounding standing ovation, Mr. William Bill Clinton. Yes. Yes. Now, I'm supposed to read the award, so let me do that first. The Irene Diamond Award for Leadership in the Fight Against AIDS, presented by the Irene Diamond AIDS Research Center to President William Jefferson Clinton, October 15, 2009. I know we can't figure, I think we're supposed to, are we supposed to be here? David? And hold on one second. Before you go on, Mr. President, I know I'm supposed to say who designed it, so can you do that for me, Dr. Ho? This beautiful award.
Yes, this has got to be low. This building and this award was designed by Raphael Vinodi.
Please stand up. Please stand up. Yeah.
Well, if I had any sense, I wouldn't say anything. I want to thank first David Ho and all the people at the Irene Diamond AIDS Research Center for 1,000 things, some of which I will mention. Lucy Liu, thank you for being a part of this night and for the good work that you do. Usually I think it's a good thing to be introduced by a friend, but I think I love Magic Johnson. I would take a bullet for him, but I think he overdid it tonight. I think David Ho is a hell of a lot smarter than I am. And to tell you the truth, one of the most humbling experiences I had as president, and I had quite a few, was I actually was invited to be the co-commencement speaker at MIT with David Ho. It's sort of like Albert Einstein meets Curious George the monkey, you know. It was, there we go. I mean, I thought somehow he was going to point me out as a lab sample or something. But we had met briefly once before when he came to a state dinner for his young men, and David and I have had the opportunity to work a lot since. We went to Tsinghua University to a big AIDS conference in China after I left office. And not long after, he had toured me with Irene through the labs here. And one of the most exhilarating experiences I ever had. I got to go and tour and meet all the young researchers and everything. It was 7 years ago. And then we did this deal at Tsinghua University. And Chinese and I had a good relationship with the government because we had brought them into the World Trade Organization and we'd worked. And I was trying to get them then out of denial and being afraid of dealing with AIDS and to try to get on top of it because I knew that we could make a quick pivot there. So David and I went there and spoke, and it was the first time. It was very interesting. We had 4 senior ministers in the Chinese government there, and they televised this meeting on television. So we spoke, and then this young AIDS activist who could have been here in New York City stood up with spiky hair and started yelling at me about something I hadn't done. And I said, come up here. So the guy comes up here, and I put my arm around him and shake hands with him and talk to him. And then I took him down the aisle, and he shook hands on national television with these Chinese ministers, none of whom had ever shaken hands with an HIV-positive person before. And they didn't, obviously were not prepared for this, but they figured if I did it, they'd probably survive it. Within 10 days, the Premier Nguyen actually had AIDS activists in his office, televised, to talk about a national AIDS strategy. Within a few weeks, the president of China was walking into rooms of desperately ill people, shaking their hands, all televised. Next time I went to China, I went at the request of the Chinese government out to distant provinces where most of the infected people had gotten it from contaminated blood transfusions, which, as many of you will remember, afflicted the United States in the early 1980s before we perfected our testing. And the government said, you got to go out there. They kind of like you out there, and there's still a lot of bigotry and fear. So I went out at the instruction of the Chinese government to be photographed sitting on the floor playing games with children with HIV and AIDS. I say that because now the research center we honor tonight is the coordinator of the Chinese AIDS Initiative, and we are their partner there. And it is one place where I think we're all doing a pretty good job. And I feel a deep debt of gratitude to Irene Diamond, and I wish she were here, and to David Ho for a lifetime of work, widely recognized but never enough, and to all the young people who labor at the research center here for the work they are doing. I just want to say one other thing. Magic Johnson and I have been friends since 1992. And I was just like David. I was just sort of a starry-eyed basketball fan when I met him. But I want to tell you what I really respect about him. I love the way he helped America deal with the fact of HIV. I love the fact that he did what I tried to do when I left the White House. He knew that there might never be another point guard that played like he did or enjoyed it as much as he did, and he made up his mind from the day he walked off the basketball court for the last time that he would not waste 5 minutes wishing he could still do what he could not do anymore. Instead, he would bring the same talent, the same passion, the same concentration to a whole new chapter in his life. And I can't tell you what a role model he is to not only to African American kids, but to kids from poor backgrounds or kids who are first generation immigrants. And he invests money and makes money in places that a lot of people leave out and leave behind. And he is a very close friend of Hillary's and mine, and we do love him. But we should all love him for showing that there is joy and life after basketball, and that the fame is a byproduct of the joy and excellence which can be brought to other equally worthy endeavors. I'm really proud of him, and I'm grateful to be here with him tonight. Now, our foundation is sort of at the other end of the supply chain, if you will, from the brilliant research work done at the Research Center. When I left office and I got involved in this work because at the time, the Global Fund on AIDS, Tuberculosis, and Malaria had not been stood up. I organized it in the last months of my presidency, but it couldn't be established until 2001 and was not funded even then. And the United States was providing about, a third, maybe more, of all the money being spent in the world, and we were only spending $200–300 million a year, and I got an appropriation, I think, to go to $6 million right before I left. And that was before President Bush and the conservative Republicans decided this is one thing they wanted to spend money on. And I honor them for that, and that led to the PEPFAR program. But in the beginning, Nelson Mandela and I were just going around the world rattling a tin cup trying to raise money for treatment and care. Then when the money came on, it was obvious to me that most people had not given much thought about how to spend it and how to make it go as far as possible. And I remember being approached when Madiba and I closed the AIDS conference in Barcelona, I think in 2003. by the Prime Minister of St. Kitts and Nevis, who was himself, Denzel Douglas is a medical doctor, and he said, look, we in the Caribbean, we have no denial problems. We have no shame problems. We're cool with this. I said, what are your problems? He said, money and organization. I said, well, Denzel, what do you want me to do about it? He said, I want you to fix it. And like a fool, I said, okay. I hadn't a clue. I hadn't even built my library yet. And we hadn't any funding sources. We hadn't anything. But when we analyzed it, we realized that most people were paying somewhere between $400 and $500 a year for the generic drugs that we pay $10,000 a year for at our Harlem AIDS Clinic, and they pay about $3,500 for in Europe and Canada. But $500 was a lot of money in all these poor countries in Africa with an income of $1 or $2 a day. And there were in the developing world only, and in middle-income countries, you know, only about 200,000 people on treatment, and 130,000 of them were in Brazil and Thailand, where the government was paying the bill. So I called our magaziner who'd worked with me on healthcare and a few more people. We started analyzing this, and we realized that even the generic drug companies were running their ARV business literally like a jewelry store in a small town. You know, if you run a jewelry store in a small town, you got to keep a big inventory because people want to look at all the watches and pick among rings. And you know your volume sales are going to be low. And besides that, payment is uncertain. I mean, somebody might bring the engagement ring back. So you think about it, it's a low volume, high profit margin, uncertain payment business. And it was obvious that in the distribution of antiretrovirals, we needed to get into a grocery store model. Huge volume, low profit margin, absolutely certain payment business. And so I went to the Irish and the Canadians first, and then to other governments, and got them to commit to give, not to me, but to countries, a certain amount of money for a 5-year period if we certified them as being able to do the testing and all the work they needed to do to treat people. And pretty soon, we were buying those medicines for $140 a year. And then we got it down to about $120 a year. And now everybody in the world can buy the generics within 20% of our cost because it's neither practically nor morally acceptable for our foundation to get that much better a deal than anybody else can get. The children's medicine, because the volumes were so low, were at $600 a year. They'd been reduced to $60 a year. And then thanks a lot to the research done here, we've been able to get combined medications, which have made it much easier to have high levels of adherence, because you know you got to follow the regime 80% of the time or the medicine won't work. And we've now done the same thing with second-line medicines. We're down almost 40% from the maximum prices there. So that's why of the 4 million people on medication in the world, about 2 million buy them off the contracts we've negotiated in more than 70 countries. About 2/3 of all the children who have to have pediatric AIDS medicine get it off these contracts. That all sounds impressive, but only 38% of the kids in the world who need the medicine are getting it. So we're still losing 300,000 or 400,000 kids a year who could easily have normal lives if we could get them. Which brings me to the next point. It may seem far removed from the lab, but it's very important. We have medication that's 98% effective in preventing mother-to-child transmission, but a lot of mothers are going to transmit to their children. Nobody's going to die of AIDS this year anywhere in the world because of the price or lack of availability of the drugs, but a lot of people are going to die. In America, a few will die because they simply can't get a drug mix right after a certain period of time that will keep them alive, or because for whatever reasons they're not as happy to be alive as Magic Johnson is and they don't keep their regime up. But most of the people who die of AIDS will die not because the medicine is too expensive or the medicine is unavailable or because they don't keep their regime. They will die because of the absence of health systems. I mean, when you bring AIDS medicine to a poor country, it's not like the Berlin airlift after World War II at the dawn of the Cold War. You can't just drop this stuff with a parachute. You have to have someone there to do the testing to see if you're positive, then to give the medicine, then to test again to see if it's working or if you need to change the mix. Then to make sure every couple of weeks that somebody clearly understands the regime, and if it's a severely malnourished adult or any kind of children, that they have the nutritional supplements they need. These systems that we take for granted in this country are killing. The absence of them is what is leading to the high death rate from AIDS all around the world. So I spend more and more time trying to do this. We have 165 people working in Ethiopia. Ethiopia is a good example. Big country, 80 million people. 48 million live in villages of 1,000 or fewer, a minimum of 60,000 villages. If we decided to take our musicians here and get the biggest plane around and all cram on the airplane and fly to Addis Ababa tonight because we wanted to eat, drink, and party all night and get up in the morning and look at King Lalibella's churches carved in stone during the time of Genghis Khan. And alas, we all got food poisoning on the way to Addis. When we arrived there, wretchedly ill, we'd be well taken care of. We'd be just fine because the capital city has a good healthcare system. If you met the Ethiopian health minister, you'd be quite confident to have him become the director of public health in New York City, or maybe even the Secretary of Health and Human Services. He's a terrific human being. But in this great country where literally almost 60% of the people live in somewhere between 55 and 60,000 villages, there were, when we started, in the entire country, a grand total of 700 clinics. And we're talking very rudimentary clinics. So it became obvious to us that our foundation had done nothing for them by making available the medicine. We had to help them, and we developed a national plan to build 3,500 clinics, and believe it or not, even with all the tens of thousands of villages, with 3,500, nearly everybody will be within a day's walk of a basic clinic. And this is the difference in life and death. So when you think about how to deal with this problem, and the mortality still coming out of malaria, out of tuberculosis, infectious diseases, dirty water, cholera, dysentery, diarrhea, it's very important to ask yourself always, what kind of human network do you need? How do you make the research done here come alive there? But it's also important to remember that there wouldn't be any there. Nothing I do would be possible with all these wonderful young people who work, and sometimes not so young people. It's finding their second careers like magic in me, working in this foundation work, if there were no here, if there were no research center, if these barriers were not being broken, if they weren't constantly looking for not only better medications and someday a vaccine and a cure, and in the meanwhile, easier ways to distribute and consume this medicine, then all the stuff that the rest of us do wouldn't amount to anything. So the good news is 4 million people are on treatment. The good news is a huge number of children are and getting nutritional supplements. The bad news is 1 in 4 deaths in the world this year will still be from AIDS, tuberculosis, malaria, and infections related to dirty water, primarily because of the absence of health care systems that are not expensive but are labor intensive. And so that's what I ask you to think about. It may seem counterintuitive, but what the world needs is both more investment in research like the work done here and more people at the grassroots level. But we can turn this around. And the more I do this work, and I'm now working in Haiti, and we just upped our AIDS cooperation there, they got the best chance of my lifetime to escape the chains of the past, to stop being the poor stepchild of our hemisphere, because they're developing the capacity to lift themselves and therefore can accept other people's help. But it's really important to remember we're a long way from home in dealing with HIV, either in finding a cure or a vaccine or in having the healthcare networks necessary to keep people from dying from AIDS and its corollary complications like malaria and tuberculosis. But we are coming together. When I started this work, I was excoriated by many big pharmaceutical companies. And I had a huge argument with the then president of Pfizer in Paris one night, who was screaming at me that my medicine was no good, this stuff made in India, and that it was only 60% as effective as Big Pharma's drugs. And I should be ashamed of myself for raising money from the Canadians, the Norwegians, and the Irish and all to do this. And I looked at him and I said, you know, if I were you, I wouldn't make that argument anymore. He said, why? I said, well, let's assume you're right. I said, the fact is, you're wrong, but let's assume you're right. Since your medicine is 10 times as expensive as mine, and mine is 60% as effective as yours, for the same amount of dollars, I'm still saving 6 times as many lives as you are. You need a better argument. And later, I actually worked out a deal with President Bush to allow us to present the generic medicine to the Food and Drug Administration, and if they approved it, then even the U.S. money, PEPFAR, could be spent on it. And I honor him for this. He kept his word. And of the 16 medications we presented, I think all but 2 were fully approved. And so even the U.S. tax dollars in PEPFAR are now helping to save lives in Africa and elsewhere. I say this to you thank you, by way of emphasizing that this Diamond Research Center is an unbelievable gift not only to America but to the world. And if you ever get a chance to meet all the young people who work there from all over, I mean, it's a mind-blowing experience. The work done by people who try to save lives at the grassroots level is a gift to the world. But there are still people dying simply because they're poor in places that have no health networks. And so I'm honored with this award, and it will inspire all of us every day. It really belongs to all the people in my HIV/AIDS initiative. But it's wrong that 1 in 4 deaths are exclusively concentrated among the poor, when for 10 cents you can purify a week's worth of water for a family of 4 with one of Procter & Gamble's purifications. When for $1 a month you can provide nutritional supplements that will make sure that the drugs for pediatric AIDS will adhere to the body. And when you can build these networks. So I'll keep doing what I'm supposed to do. Curious George could do it. And David Ho will keep doing Albert Einstein's work. And Magic Johnson will keep reminding us that life is worth living and no one should give up on it. And I think we'll come out of this pretty well. But I just want to leave you with this thought, just so you don't forget it. A couple years ago, I was visiting one of our field sites that Paul Farmer and I helped to build on the Partners in Health model in Rwanda. And we were way out in this little poor village. And we went to visit this gripping couple, a 19-year-old girl and her 15-year-old brother, Jean-Pierre and Eugenie. She had been supporting him since they were 12 and 8-year-old orphans when both their parents died of AIDS. She was not HIV positive, but he was. She was an attractive, normal-looking 19-year-old girl who had been an adult since the age of 12. He was a lively-looking but physically stunted 15-year-old boy who had been sick since he was 3. And it was a miracle that he lived because he had intermittent access to medicine until our program came along. And they lived in a circular mud hut, literally with not much more floor space than Magic Johnson could put his arms around. And our people built them a new home, a little 2-room home with a place in between and a cooking stove outside so they weren't in danger. But I asked this young woman, I said, so what are you going to do? She said, well, I don't know. I've just been taking care of him since I was 12. But what I really think I want to do is become a businesswoman. I said, what do you mean? She said, have you seen the lousy stores in this village? There's nothing to buy. Amazing. We're way out in the boondocks here, in an area with a per capita income of well under $1 a day. She said, I want to do a store. So I had one of my friends there from America, and she and her husband were both there, and they said, we'll finance you. We'll be your financiers in this big business venture. And so they said, you decide what you want to sell, how we're going to do it. We'll come work out the inventory purchases and how we're going to supply you, and we'll do it. So then I leaned down to this 15-year-old boy who was only this tall, and I looked into his eyes, and he had a lively intelligence, but he was still kind of shy. And keep in mind, at 15, he'd only done 3 years in school, just 3, because he'd been so sick for so long. And I said to this young man, I hope you won't give up. I hope you will stay in school. And all of a sudden, he threw his shoulders back, and for the first time, he looked up at me, and he smiled. He said, oh, no, why would I do that? I'm going to stay in school until I become a doctor so I can help other children who were sick like me, and they won't go through what I've been through. It never occurred to him that he was a 15-year-old kid with stunted growth in one of the poorest places on earth who'd only had 3 years of schooling, that he couldn't still become a doctor. Now, what is the point of that? Intelligence is evenly distributed in the world, and so are dreams. What is not evenly distributed is opportunity, structure, a predictable set of consequences to the efforts that are exerted. And I spend a lot of time in the world with people who are dirt poor. Poverty doesn't kill anybody. I grew up in Arkansas when the per capita income was 56% of the national average. What kills people is not being poor. What kills people is being convinced that tomorrow is going to be just like yesterday, no matter what. And as long as people believe that tomorrow can be different from yesterday, they can move mountains. So when you go home tonight, you just think about some scientists you may never meet, giving kids just like that little boy in that remote village the same chance you had and now take for granted to develop your mind and to live your dreams. Thank you very much.